Lymphoma is a frequent occurrence in dogs, sadly accounting for a large percentage of all blood-related cancers and a significant portion of all malignancies diagnosed in this species.
That's right, John. And B-cell lymphoma is the most prevalent subtype of lymphoma in dogs. The current standard of care typically involves multi-agent chemotherapy, often using protocols based on a combination of drugs like cyclophosphamide, doxorubicin, vincristine, and prednisone. These intensive treatments, known as CHOP-based protocols, can initially be quite effective, with a high percentage of dogs achieving complete remission.
However, despite these initial successes, the long-term outlook hasn't seen significant improvement in many years. The median survival time for dogs with B-cell lymphoma treated with CHOP has remained in a similar range for the past 3 decades, which is something the veterinary oncology community is actively working to improve.
Exactly, John. This is where the research we're discussing today comes in. In human medicine, the treatment of diffuse large B-cell lymphoma has been revolutionized by the addition of rituximab to the CHOP chemotherapy regimen. Rituximab is a humanized monoclonal antibody that specifically targets a protein called CD20, which is found on the surface of both normal and cancerous B cells. By targeting CD20, rituximab helps to deplete B cells through various mechanisms, ultimately improving patient outcomes significantly.
That sounds incredibly promising for human patients. So, why haven't we seen the widespread use of rituximab in dogs with lymphoma?
That's a crucial question, John. Unfortunately, human rituximab doesn't effectively bind to canine CD20, and therefore doesn't deplete canine B cells. Furthermore, even if it did have some activity, the canine immune system would likely rapidly develop neutralizing antibodies against this humanized antibody, limiting its effectiveness. Recognizing this gap, several research groups have been working to develop canine-specific anti-CD20 antibodies, essentially creating a caninized version of rituximab.
And the study we're focusing on today investigates one such antibody, right?
Yes, John. This study focuses on a canine chimeric anti-CD20 antibody called 1E4CIGGB. The study reported that the majority of dogs, around 79%, experienced a complete remission by 3 to 4 weeks after starting treatment. An additional 21% experienced a partial remission, resulting in an overall response rate of 100%. However, it's important to note that none of the dogs that initially had a partial remission went on to complete the entire planned treatment protocol.